Good morning, everyone, and thank you for joining us this morning. We have a very, very, very important discussion that we are going to have on green infrastructure, and I wanted to share first, however, some brief remarks on the coronavirus rescue package as it heads from the House of Representatives to the Senate. On Friday, the House of Representatives passed the $1.9 trillion American Rescue Plan that meets the urgency of the moment and the scale of the crisis. The package will provide America with more shots in arms, money in pockets, children in schools, and people in jobs. This package also included a provision to increase the federal minimum wage to $15 an hour. But let me just come back again and focus on this. We're going to receive in Massachusetts massive amounts of money for our fight against the virus, helping kids stay in schools, helping to fund the cities and towns so that they can make it through this pandemic, helping those who are unemployed to get an extra amount of money in their unemployment check as we expand it, ensuring that people get $1,400 as a check so that they have that money, everyone, to be able to make it through this pandemic. All of that is in this package. It is absolutely critical that we pass it. But the package also included a provision to increase the federal minimum wage to $15 an hour. Unfortunately, the Senate parliamentarian ruled this week that this minimum wage provision does not meet the requirements to be included in the rescue package that the Senate will vote on this week. Democrats are continuing to develop options and strategies in the package to ensure that working people across our country are protected and paid a living wage. No person in America should work full-time or have multiple jobs and still be stuck in poverty. Millions of people in our country have been trying to climb into the middle class, but no matter how hard they work, they are stuck in the same place. Every single healthcare worker, fast food worker, janitor, and essential worker who have kept Massachusetts and our country afloat for the past year needs real COVID relief that includes $15 an hour. And that's why they elected us in November, and we need it to get done in the Congress. $15 is just the beginning. It is the ground floor. And Democrats are making it clear that we won't stand Republican obstruction of this COVID relief package. We will pass this with a simple majority if needed. The same must hold true for the minimum wage. If we cannot get this provision passed within this rescue package, we must do what it takes to deliver for the American people and abolish the filibuster to pass a $15 federal minimum wage. We are going to do everything we can to include some form of a federal $15 minimum wage in this package. And if we can't, we should work immediately to abolish the filibuster, because we have to guarantee that families get the income they need from their hard work to take care of all of their needs. And a $15 minimum wage is just the beginning. So if Republicans are going to stand in our way of providing families the protection and support they deserve, we cannot let the antiquated, racist vestige of Jim Crow era procedure known as the filibuster to stand in the way. Raising the minimum wage is about giving families the security to know they can make ends meet, the opportunity to climb out of poverty into the middle class, and the dignity that they are getting paid a fair wage for a hard day's work. Our fight does not end with the parliamentarians' ruling this week. We will abolish the filibuster and ensure that families across our country are given the support that they need. The battle is just beginning. Now, I'd like to turn to our incredible guest joining me today and get started with our live stream conversation. My special thanks to the speakers joining me, Mela Bush-Miles, the Transit-Oriented Development Director at Alternatives for Community and Environment. Yanisa Teshaganton, a transportation planner and Sunrise Movement Boston organizer. Kevin Mills, the Vice President of Policy for the Rails to Trails Conservancy. And Dr. Manny Berengi, an occupational and environmental medical physician at Boston Medical Center. We've organized today's event to discuss our shared vision for a green, resilient, and equitable transportation system, one that helps solve the climate crisis rather than continuing on as the leading source of carbon pollution in the United States. To achieve that goal, we are fighting for an infrastructure package that breaks away from business as usual, which has always meant just building highways and poisoning our planet. President Biden has promised to work with us on a bold, aggressive, and green infrastructure plan that will create millions of new jobs while addressing our ever-worsening climate crisis. We have an opportunity as we recover from this crisis to fund green infrastructure and transportation projects that reduce emissions, promote safety, and ensure accessibility for all users of the road. We can take real, aggressive steps right now to paint our streets green. But first, we must end the year after year increase in greenhouse gas emissions from our transportation sector. Right now, transportation accounts for over 28% of America's total emissions, more than energy, industry, or agriculture, and that figure just keeps increasing. To course correct, I recently reintroduced the Green Streets Act, legislation that directs the Department of Transportation to establish strong standards and metrics for reducing greenhouse gas emissions and vehicle miles traveled on the national highway system. My bill requires that states, out of compliance with these standards, dedicate federal highway funding towards achieving these essential climate goals. I have also introduced the Freezer Trucks Act this week, legislation that will help replace diesel-powered refrigerated trucks with cleaner electric versions in the overburdened frontline communities that continually bear the worst impacts of pollution. This is a justice issue for communities like Chelsea, Massachusetts, where idling shipping containers contribute to the already devastating poor air quality. But we cannot stop there. Driving is by far the main source of transportation emissions. So we must significantly expand and promote alternative modes of travel. And that means pedestrian, sidewalks, bike paths, and improved public transit options. And that's why I'm fighting to ensure that the Senate passes this coronavirus relief package this week. This package that we're voting on this week includes $28 billion for our transportation system to keep transit workers on the jobs. The MBTA, the other transit systems. This relief package also includes an additional $2 billion for our Amtrak system. That's in this bill. Not only do we have the funding in to fight the coronavirus, to keep schools open, to ensure that people get unemployment checks and everyone gets a $1,400 check, but $28 billion is in to keep our transit workers on the job. It is absolutely critical that we do that. Unfortunately, our ability to move around without relying on gas-guzzling cars is threatened by a national safety crisis. Pedestrian and bicyclist fatalities increased nearly 51% between 2009 and 2018. In 2019, more than 6,000 pedestrians and 800 bicyclists were killed in crashes with motor vehicles. That's why I have introduced the Complete Streets Act, legislation that will require states to set aside a portion of their federal highway funding for projects that include safe and accessible transportation options for all modes of travel, as well as people of all ages and abilities. And similarly, I have introduced the Connecting America's Active Transportation System Act, bipartisan legislation that dedicates $500 million annually to connect walking and biking infrastructure into active transportation networks that allow people to reach destinations within a community, as well as travel between communities, all without ever needing a car. These investments are critical for reducing carbon pollution and improving safety on the road. At the same time, these programs will help us lead the world into a new era of affordable and healthy transportation. They will center equity as we improve everyone's access to work, school, and other critical services. By passing these various bills, we can help stop the climate crisis before it gets any worse. But even as we work towards that all-important goal, we must also respond to the impacts of climate change that are happening right now, including extreme weather, sea rise level, and more powerful storms. To keep communities resilient, our infrastructure must be capable of surviving these events. We need to be able to respond to accommodate first responders delivering aid after a disaster and facilitate mass evacuations in the worst case scenarios. Unfortunately, our transportation routes are not as resilient as they should be. And that's why I recently reintroduced the ESCAPE Act, which will provide $1 billion annually to improve, fortify, and replace life-saving evacuation routes, including the Cape Cod bridges, which serve as critical escape routes for our Cape and Island residents. These resources are needed to harden our infrastructure in the face of climate change, as well as protect our communities while we work to achieve a long-term transportation transformation. In the months ahead, Congress is poised to make massive investments in infrastructure, both as part of an economic stimulus package and through our regular reauthorization of federal surface transportation programs. These legislative packages are our opportunity to save all of creation while engaging in massive and critical job creation. We can and we must build a green, resilient, and equitable future. I look forward to working with everyone on this call to make that vision a reality. So, and I thank each and every one of you for joining us today. So first, I'd like to introduce Mela Bush-Miles, the Transit-Oriented Development Director at Alternatives for Community and Environment, to say a few words. Welcome, Mela.
Thank you. It's my honor and my pleasure to be here to speak at this momentous event. Right now, so my name is Mela Bush-Miles, and I work for ACE, Alternatives for Community and Environment, a nonprofit in Roxbury, Massachusetts, that has been organizing around climate justice, transit justice, and environmental justice for over a quarter of a century. In my work there, we have currently been working on Transit Equity Month. So there's a national movement to focus on transit equity, and we had Transit Equity Day on Rosa Parks' birthday. Last year, we asked the City Council to lift it up to Transit Equity Week, and they proclaimed it, and this year it is Transit Equity Month. So this is the last day of Transit Equity Month, and I think that this is a good time to be having this conversation and to be moving these bills forward. Currently in Boston, there is a number of coalitions, including Alternatives for Community and Environment, are working to bring together folks to work on zero emission vehicles. We're working to create the environment, the infrastructure, and to get the MBTA to move forward with creating the opportunity for us to lower our greenhouse gas emissions in our community. I said when others get a cold, the Black community gets pneumonia. And so as you can see in the coronavirus outbreak, there's a higher mortality rate of folks in lower income and communities of color. And that problem is exacerbated by higher particulate matter and more greenhouse gas emissions because of the airborne nature of this disease, as well as other pre-existing conditions. So we really need to address how to get these emissions lowered. And another thing that we see that's happening right now is that the MBTA is moving toward enhanced electric buses. An enhanced electric bus is a diesel-powered electric bus. Over 20 years ago, we got rid of diesel-powered buses and they were banned from coming into the communities of color because of the Clean Buses for Boston work that we did, and we got diesel-powered buses out and replaced them with compressed natural gas. So if they bring back diesel-powered, it's just going to make our air quality worse. So we need this legislation that is being moved forward to address issues like that, so that, you know, whether it's environmental justice, the Green Streets Act, all of that will come together to culminate in work that will help us to address the issues that we have going on there. So many, at least 3 of my friends have already passed away from coronavirus, and we're hoping that it ends soon. But if we can get the legislation passed now and address the issue of, like, the MBTA trying to buy more, sneakily buying more diesel-powered buses when we do not need any more diesel particulate in our environment, we need to stop that from happening. So in our activism and in our organizing, we're also looking at things like the diesel emissions reduction ordinance that the city of Boston passed years ago that is not being enforced. So having the work on the federal level with Senator Markey working so hard and so in lockstep with us to get this work moved forward is going to be able to bring forth what we need to happen right now. We don't have years. You know, there's Sunrise Movement, and they're working on, you know, in the extinction generation folks are saying, you know, we only have like 9 or 10 years to get this right. So if we can reduce these emissions now, we can make a future for our children, our grandchildren, and our great-grandchildren. So we need this to happen so that we can be the change that we want to see. And we will continue to work with the congressman to make sure that that does happen. So thank you for allowing me to come and bring our message forward today.
No, thank you so much. And you know, when you're talking about diesel buses, in 20 years, people are going to be thinking about diesel buses the same way we now think about smoking on airplanes. What was that all about? How are we allowing those kinds of toxics to be put into the lungs of people on planes or on the streets of our country? So you are so wise to be at the cutting edge.
We need 100% electric. It should be completely electric. You know, whether it's in motion or, you know, connecting up and, you know, charging stations along the way, or whether it's actual catenaries that need to be built in a creative, aesthetic way to actually bring the electric buses back completely electric, to electrify the whole system. That's what we need to happen, whether it's our commuter rails, our buses, or our vehicles, our cars that we're driving, make it affordable for the lower income communities to be able to access electric cars and vehicles, and change the whole environment by how we move around.
No, you know, and I know we can do it because when I was a boy, we used to go in on the electric trolley into Sullivan Station and then to downtown Boston from Malden and Medford, just right down the middle of the street. So we just have to go back to the future. It was already there, but now it's even more urgent that we have that we have to deal as well with the climate crisis. So it's this equity issue and the climate crisis that are merging as a single issue. So thank you so much. Now I'd like to invite Yanisa Teshaganton, a transportation planner and Sunrise Movement Boston organizer, to speak.
Thanks, Senator. I'm so glad to be here. And yeah, hi everyone. My name's Yanisa. By day, I'm a transportation planner, and by night, I organize with the Boston hub of the Sunrise Movement. And Sunrise is a movement of young people working to stop climate change and create millions of good jobs in the process. And in Sunrise, we like to envision the better world we're fighting for so that we can strategize on how to get there. So when I close my eyes and envision what our future can look like, I see people moving around how they want to. I see that people are able to get where they need to go to access good jobs and social services without being constrained by how we build our cities. And for this future to happen, it requires transportation planners like myself, my colleagues, not to plan for cars and how to move them around most efficiently, but rather to plan for people and their access to mobility options that are fast, reliable, and good for their lungs. However, the reality is that, as Senator Markey was saying, the way that the federal government currently funds transportation projects is totally counterproductive to this vision, and it frankly makes transportation planning for this better world pretty hard. And the transportation sector emits the biggest share of greenhouse gas emissions in the US, yet the vast majority of transportation funds go to highways and their continuous expansion. And highway expansion leads to this vicious cycle of more cars on the road, which leads to calls for even more highway expansion, often at the expense of communities of color who live nearby and their ability to breathe. So in a way, highways are fossil fuel infrastructure. And like other fossil fuel infrastructure, the US can't seem to stop building them. And of course, the shift to electric cars is incredibly needed, but it's also not enough considering that they still cause congestion and pollution from their tires. And given that we only have a couple decades left to stop climate change, we need to dramatically change how we fund our transportation system. And we need to prioritize people walking, biking, and taking public transit and build our cities so that people don't need to rely on cars. So growing up, I spent a lot of hours, like so many hours over my middle school and high school years, waiting at a bus stop alongside a 6-lane road of cars going 50 miles per hour in all kinds of weather without a shelter. And even back then, little Unisa Middle School, it was clear to me that the government and the decision makers cared a lot more about people driving solo in their personal cars than the packed buses of young people, of working class families, of Black and Brown folks who rely on public transit and walking and biking. And we now have a chance to fix the ways in which we prioritize transportation projects, and that priority has to be with our communities and our climate. And the green transportation bills that Senator Markey has introduced this week move us closer to this vision of a better world by investing more in our ability to get to where we need to go by walking, biking, and taking public transit, and reducing the emissions that come from our vehicles on our streets. So I'm very excited to get these bills passed alongside with the Green New Deal with Senator Markey. So I'll pass it back to you, Senator.
Thank you, Yanisa, so much. And again, that's why we're fighting so hard to put in $28 billion for transit into this bill, because we don't want to see a collapse of the transit system. We want to make sure that it continues to function for everyone. And we want to be ensuring that people feel encouraged to use public transit. And that's a big part of this bill, the coronavirus relief package right now. And so thank you so much for all of your efforts and for Sunrise's efforts as well. Sunrise is right there, right at the cutting edge of fighting for the fundamental changes which we need in our society. So thank you.
Thank you.
Since Alexandria Ocasio-Cortez and I introduced the Green New Deal just 2 years ago, February of 2019, everything has changed in terms of the discussion. Everything has changed in terms of what people think has to be done and can be done in order to transform our relationship with these greenhouse gas emitting, climate crisis creating gases. And your leadership, Sunrise Movement, has been absolutely indispensable in making that change in the conversation possible. So thank you.
Thanks, Senator.
Now I'd like to introduce Kevin Mills, the Vice President for Policy at Rails to Trails. Welcome, Kevin.
Thank you, Senator Markey, along with your co-sponsors, Senators Sullivan and Van Hollen, for your leadership on the Connecting America's Active Transportation System Act. This legislation is sorely needed to make it safe and convenient to walk and bike to everyday destinations like jobs, schools, shops, essential services, and to transit, as you emphasized. And it focuses that federal investment on connecting existing trails, multi-use trails, sidewalks, and bikeways to the places we need to go within and between our communities. And this is a really critical step because it's going to enable more people to choose walking and biking over driving for some of their trips. And with more than half of driving trips in America, surprisingly, within a 20-minute bike ride, and about a quarter of them within a 20-minute walk, there's a tremendous potential to reduce miles driven by meeting this burgeoning demand we see for accessible, safe, active transportation routes. Now, Congress created a pilot program 15 years ago that proved that this approach works with relatively modest strategic investments in active transportation in 4 geographically diverse communities. Walking trips rose 36%, biking trips increased 14% in just a 3-year period, and then driving dropped in those communities. So in those 4 communities, as a result of the pilot, in 2010 alone, we saw 16 million miles walked and biked that would otherwise have been driven. And Rails Trails Conservancy has calculated that investing in a national scale on shifting short driving trips to active transportation, which your bill will do, right, could ultimately save 6 billion gallons of fuel a year and reduce carbon emissions by 54 million tons each year. To connect the country, America built a rail system in the 19th century and a road system in the 20th century. But our societal needs have changed. Our climate goals depend on driving less. Growing inequity compels us to take seriously the mobility needs of those who don't drive. Spiking pedestrian and bicycle fatalities demand that we design our communities differently, and public health depends on us being more active. So by connecting America's active transportation system, we'll meet these 21st century needs for mobility that's not only truly emissions-free, but it's affordable, it's equitable, and it's safe, and it's good for public health. And further, building active transportation networks will create more jobs per dollar invested than other infrastructure investments because it's more labor-intensive work. So in short, investing in active transportation connectivity will yield a huge return on investment for our country. By leveraging our existing active transportation infrastructure to create safe routes to everywhere for everyone, we can affordably create communities that work better for everybody and take a substantial chunk out of our automotive carbon burden in the process. So thank you again for your leadership on this critical legislation.
Thank you, Kevin, so much. And by the way, I'm very optimistic about this legislation, not just because I'm partnering with Chris Van Hollen, who's another Democrat and from Maryland, but with Senator Sullivan from Alaska. He's a very conservative Republican. Mm-hmm. I think these issues have a real potential for a pathway for passage of legislation that deals with these issues, because they should be non-ideological, especially when we reach the point right now where we have President Biden out riding his bike as a good demonstration from the top of our government that we need to be out there and riding our bikes and exercising. And we also have a president who now really believes in Amtrak. I mean, his nickname is Amtrak Joe. So he's somebody who clearly believes in public transit. So I think we can make this bipartisan. I think we have great leadership right from the top. And agree, again, we want to make it easier for people to walk. I keep my Fitbit on me all day. I try to get my 10,000 steps every day, try to get my 5 miles in, absolutely essential, because this kind of legislation is good for the health of the planet, but it's also good for the health of individuals. And if we do it right, I think it's a great package, and it's something that we're going to drive very hard to get passed this year. And last, but certainly not least, I'd like to welcome Dr. Manny Berenji, an occupational and environmental physician at Boston Medical Center, to say a few words.
Thank you, Senator Markey, and thank you, fellow colleagues and advocates. My name is Dr. Manny Berenji. I'm an actively practicing physician here at Boston Medical Center and an assistant professor here at Boston University School of Medicine. I would like to provide some insight into the public health impacts of transmission emissions, especially among our African American and Hispanic American populations. Many of my patients come from East Boston, Roxbury, Dorchester, Mattapan, and the surrounding Boston metropolitan area. Many of these communities are by busy transportation routes, and these include highways as well as streets. My patients generally come in to see me for their back pain or arthritis, or for their motor vehicle or pedestrian accidents. And oftentimes I see that they're experiencing other ailments due to their immediate environments. Many of my patients have asthma and underlying heart conditions, many of them only in their 20s or 30s. I've had a number of instances where I've had to provide life-saving treatments for these folks, especially if they're having an asthma attack. I've had to provide refills for their asthma medications or other heart medications because they couldn't get in touch with their primary care provider and they were in desperate need of getting their medications. The past year, I've actually utilized new technology such as telemedicine, and I've been able to actually see what's happening within these people's homes. I've actually found that many of these patients live by very busy roadways, and I could actually see with my very own eyes where they live and how their immediate environments impact their health. Due in part to discriminatory zoning and lending practices, as well as racial segregation in the United States, many Black and Latino families are significantly more likely to live in these congested areas, experiencing 38% more air pollution concentrations compared to their white counterparts, according to the U.S. Energy and Information Association. And researchers have found this to be the case in Massachusetts. In a recent study by my colleagues at the Boston University School of Public Health, concentrations of fine particulate matter, known as PM 2.5, as well as nitrogen oxide, were highest for Black and Latino communities in Massachusetts, actually worsening over the years, while other areas in the state have seen significant decreases in their air pollution levels over the past 20 to 30 years. Recently, researchers at the Harvard T.H. Chan School of Public Health have released a nationwide study finding that long-term exposures to fine particulate matter actually led to a higher COVID-19 death rate. Focusing on innovative solutions to reduce transmission emissions and particulates in our atmosphere can benefit us all, especially those of us who live in areas where these emissions are already highly concentrated. Partnering with local and regional stakeholders, as well as advocacy groups, is critical. Utilizing handheld and digital sensor technology can help physicians like myself track what our patients are exposed to in real time. We can then follow the trends and inform our public health partners in a timely manner. In combination with progressive transportation policies being put forth by Senator Markey and his colleagues, these efforts can help result in reduced number of asthma cases, heart disease cases, stroke, and many other conditions where cumulative exposures to transmission emissions can lead to severe disease. Thank you so much for the opportunity.
Thank you, Doctor, and thank you so much for being a cutting-edge occupational environmental physician expert at BMC. Actually, Congresswoman Ayanna Pressley and I, we worked successfully to have the EPA begin to install monitoring equipment over in Chelsea, which had never had it, in order to determine where the levels of exposure of people in that community. They're already in a situation where, because of the airport, because of all the oil storage in Chelsea, because of all the idling diesel trucks in Chelsea, they're exposed to dangerous toxic materials in a way that other communities are not. And as we know, asthmas and other lung diseases are a precondition to them being more vulnerable to the coronavirus. And Chelsea is at the top of the list of the communities that have been most adversely impacted by the coronavirus crisis. So all of this is interrelated. And in fact, we've put more funding into this bill that we're debating right now for environmental monitoring. We've built it in this bill, but there's a lot more we're going to have to do in the subsequent pieces of legislation, which we will be considering this year to deal with the environmental justice issues that have clearly been exposed, a lot of it because of your work, Doctor. But the Green New Deal, its intent was to focus upon the disproportionate impact which all of these dangerous toxic materials have on Black, brown, immigrant communities in Massachusetts, but across the whole country, now and historically. So thank you so much. So does anyone want to jump in and make any comments about what you may have heard from some of the other panelists or some additional thoughts that you might want to add for those who are watching right now.
Well, I'll just jump in and say I appreciate that Yanisa talked about priorities, because I really think that that's what this comes down to, and I feel like your legislation is finally treating active transportation in this case as the essential community asset that it is, and that it's as simple as that. Just elevating these issues up and demanding that they get a fair hearing and become part of the solution set.
Well, again, that's going to be a big part of my job, and that's what I just focused on last week in a big infrastructure bill hearing that we had in the Senate Environment and Public Works Committee, where we had the governor of Michigan and other leaders who are in talking about all of these issues, so that I would be able to focus upon them and get them to support the basic thrust of what we're all now trying to accomplish. Anyone else want to jump in? Denisa, or?
I can say a few words. Just to follow the thread of the Green New Deal that you were going on about earlier, Senator, I just wanted to just emphasize a little bit more on how prioritizing the public transit, prioritizing biking and walking is both good for the climate, on that side of the Green New Deal, but also on the job side and on the improving everyone's life side, because not having to rely on a car is really crucial in terms of being able to access more jobs, being able to get to those jobs and have it not take hours in traffic. And so this is why I really like working in transportation, because you can tackle these climate issues, but also you can improve people's lives so much by just prioritizing things in the right way.
No, exactly. And, we just had the governor of Texas last week be blaming the Green New Deal for the crisis in Texas, when we know it had nothing to do with it.
Right.
Their problem in Texas was that they allowed the fossil fuel industry and the utility industry to lower the standards of protection for the citizens of Texas. So there was a warning that now I think not just Texans, but the people across the country saw in real life. And we get a chance now this year to do something about it across the board in terms of how we construct a transportation system, but how we, in general, structure our relationship with the fossil fuel industry. So, Mela, would you like to add anything?
Yes, just want to be sure that the public transportation system is prioritized on the same level as highways and other infrastructure, because that is the people's infrastructure of how we get around and how we get from point A to point B. Even as we're experiencing here in Massachusetts, cuts and more cuts coming up in March that are, really impeding people's ability to move about, even as vaccinations are being rolled out. You can see that the MBTA and our governor is not prioritizing public transportation, and where he kept saying he didn't want to run empty vehicles. He didn't want to see ghost trains and empty buses rolling up the street. Well, I've never seen anybody shut down a highway because nobody was driving on it because they were locked in their house because of a pandemic. So we need to really see the vital importance of our public transportation system and work with our local government to make sure that they can understand and see why it needs to be prioritized. As federal dollars come in, those federal dollars need to be used to keep our public transportation up and running, even as more people are getting back out of their homes and being able to move about more freely. We see more cuts coming, and that's, running the train backwards and locking it up in the rail yard. It doesn't make any sense. So the more we can work together, because we've formed alliances and coalitions as all of this has proceeded, and we're advocating to make sure that we get things. He cut out the discount fare media where we were going to lower the cost to lower income people. He line item vetoed that out of our transportation bond bill for no reason, saying how you're going to pay for it when we had a way to pay for that. So some of those things need to be addressed now in the short term, as well as we have been working to get free buses to roll and to take the money that would have, been used to collect fares and things and reallocate that to another area of the T to make it a better place. So those things are very vital in the short term and in the local issues that are going on. And we're hoping that we can help to move those things forward with your support. And I just wanted to comment on Dr. Manny about the particulate matter. There's also the ultrafine particles that are an issue, according to the study done by the Union of Concerned Scientists. So that is actually causing more and more respiratory illness and exacerbations of asthma and more, visits to the hospital, even within my own family. My son was transported to the hospital 3 times because of an asthma attack, and they wouldn't give him a nebulizer until they got a negative COVID test. So because of vaporizing COVID with a nebulizer. So there's like really issues that are going on within the community. And just thank you for your wonderful support and what we've been doing thus far. I hope to continue to work with you on this, and I'm really excited to go forward.
Thank you so much for all of your work. And by the way, the bus yards going north out of Boston, they're 3 blocks from my house.
Mhm.
Right there on the Malden-Medford line. That's where all the buses are. And so my dream is your dream. We're going to be electrifying the buses. We just have to electrify it. I mean, we still want them to be running, but we want them to be using renewable energy sources for all electric buses and making sure the funding is there for public transportation at the same time. So that would be my dream, that we would go back to an era where that public transportation is electrified, the way it was when I was a boy, when they were called the car bonds, when all these electric powered vehicles that were on rails would be just driving by 2 blocks from my house and into Boston every day. So I think we can make that transition back to the future. Thank you so much. And again, it's indispensable to make us a healthy world, to make sure that we reduce that exposure to these dangerous toxics that are in the atmosphere. And maybe Dr. Berenji, maybe we'll give you the last word to comment upon the impact on children in our society.
Absolutely. No, honestly, it's been a pleasure listening to all these perspectives today. And honestly, at least in my clinical practice, working with adults and seeing many children as well, if we're able to get on top of, what are the main generators of these particulate matter and ozone and nitrogen dioxide and all these different particulates that are entering our atmosphere. And if we're able to curb those emissions, we can actually turn the tide, especially for kids growing up and trying to prevent as many asthma cases and other respiratory and cardiovascular diseases from developing in the first place. That would be my dream. If we can actually help these kids to have a cleaner environment so they don't develop these diseases in the first place, we can actually start to really make an impact, especially when it comes to chronic exposures to particulate matter and other types of emissions. So I think we need to do this now. We should have done this a long time ago. If we're able to really make a concerted effort, from the clinical community, from our advocacy community, and really come together to develop some really strong policies and actually make sure that these advocacy groups are getting that money to really make these changes happen, I think we can really make a difference.
No, thank you, Doctor. And thank you for your work. And thank you for your advocacy. I mean, our goal is to pass the laws so that children have to look to the history books to find that there ever was such a time that we had respiratory illnesses that were related to what we did to our environment. So Mella's son, obviously, is someone who we have to make our example, and say we can't allow this to happen. And we thank you, Dr. Berenci, for what you do every day. And we thank you, Mela, for bringing your personal story, your son's story, into our discussion today, because that's what this is all about. We know we can do this. It is not a technological problem. It is a political problem. We know that we can get this done. We know that the obstacles are just political so that we make the transition to a clean energy future. So I can't thank all of you enough for being on. And thanks to everyone else who has joined us today. And we'll be seeing you soon. This issue is not going away. We're going to continue to focus on it to make sure that we get it right for our transportation system and for the health of everyone inside of our society. So thank you all so much for joining us, and we'll see you all soon.